All right. Next slide, please. So we're going to start off with some quick introductions on who will make up the day-to-day EYC team. My name is Latajane Hull, and I serve as the program associate on the team. And not here with us today is Matt Cervantes, who is the managing director of Healthy Youth Development Programs here at the Center at Sierra Health Foundation. And I'll go ahead and pass it over to Paul Bender.
Thanks, Latajane. Welcome, everyone, and congratulations. Again, we're so excited to onboard our newest cohort of 44 partners. My name is Bulvinder Kaur, and I serve as a day-to-day lead for Elevate Youth California, and I'm a senior program officer here at the Center at Sierra Health Foundation. And I'll pass it on to Antonia.
Good morning, everyone. Very excited to share space here with everyone. My name is Antonia Gonzalez, and I am the newest member of the team, serving as the program associate here. And I will pass it over to Travis.
Good morning, everybody. My name is Travis Wells. I'm one of the senior program associates here at Elevate Youth California, and it's excited to be working with everyone today and supporting you. And I'll pass it over to Shira.
Thank you. Good morning, everyone. My name is Shira Murray, also Senior Program Associate. Congratulations. We're glad that you're here today. And I'll pass it over to my colleague, Gerald.
Hi, everyone. Gerald White here, the Program Assistant with Elevate Youth California. Congratulations. And with that, I'm going to pass it back to Latajane.
Thanks, all. I'm sure I can speak for all of us when I say we're so excited to be working with all of you throughout this grant period. Next slide, please. So now joining us today is our evaluation team. We have Marie Samuel, who is the Managing Director of Evaluation and Learning, Noemi Avalos, who is the Evaluation Officer, and Brianna Mattis, the Evaluation Associate. So our evaluation team here at the Center supports web reporting and evaluation for the EYC program. Also not here with us today is our communications team, who does a lovely job supporting with the EYC media, branding, and communication components. So we have Akita Marie Williams, who is the Managing Director of Communications, Samantha Garcia, who serves as the Communication Officer, Katie Pacini, Communications Officer, and Cynthia Moreno, who also is a Communications Officer. Later in this presentation, we will be covering a few of the EYC communications components. Also supporting on the Elevate Youth California program is our contracts and compliance and finance team members. We have Emily Chapter, who is the Managing Director of Contracts and Compliance, Lucas Cole, the Associate Controller, and Keith Wilson, the Grant Accountant. And here with us today is Yadeni, and I'll give her a chance to introduce herself.
Hi, everyone. My name is Yadani Figueroa. I am a senior contracts admin with the Contracts and Compliance team, and I will be handling everything insurance compliance.
Thank you, Yadani. Next slide, please. And finally, I'll give Jessica a chance to introduce herself, but as you all may know, the Elevate Youth California program is a program of the Department of Healthcare Services, and the Center is the administrative contractor that supports the implementation of the program. So on that note, I'll go ahead and pass it over to Jessica for an introduction.
Hi, everyone, and congratulations again on receiving an Elevate Youth California grant. We at the department look forward to working with you over the next couple of years.
Thanks so much, Jessica. All right, well, I'll go ahead and pass it over to Paul Bender, who will walk us through the agenda today. And once again, congratulations on being selected as a funded partner.
Thanks so much for those introductions, Latajane. Welcome again, everyone. We just covered our welcome. We'll go ahead and provide some program background. We'll share about our cohort partners, where you can find information about all of that on our website. And then, of course, all of the initial administrative pieces that you all are eager to hear about, learn about, whether it's your contract, insurance, an overview of the grant requirements, our comm strategy, and then we'll close out with some important reminders and have ample time for Q&A. If we do go beyond the hour, we'll stay on to ensure that we're able to answer any questions that you all have. I will say that, there's probably a number of questions as you begin your award. And for some of you, it might be your first award with the center, and for others, it might not be. And so we just want to say, be patient as we move along the various pieces, and we ask that you kindly keep the questions related to the content material at hand. We'll get to all of the various pieces, but it'll just take a little bit of time. So with that, I'm going to go ahead and pass it back to Jessica.
Awesome. Thanks so much, Palvinder, and really to the entire team at the center that allows Elevate Youth California to be as large as it is. I'm going to give a couple of background points, and I do want to just premise by saying we are so excited that this program is continuing to grow. In the last 4 years, we've given out over 290 grants specific to Elevate Youth California, which is huge. And so just a bit of background is that, as you all know, Prop 64 legalized the adult use of cannabis. And a premise to the legalization was that 60% of it would go to the Youth Education Prevention, Early Intervention, and Treatment account, also known as the YPETA account. So funding is given to Elevate Youth California and then different youth programs throughout the state of California. That's known as the California Marijuana Tax Fund. So just an FYI on that. And if we can go to the next slide. Elevate Youth California is funded by the Department of Healthcare Services. As I mentioned, it's funded through Prop 64, the California Cannabis Tax Fund, Allocation 3, Youth Education Prevention, Early Intervention Treatment account. Sierra Health Foundation, the Center for Health Program Management, also known as the Center, is contracted to support the implementation of Elevate Youth California. So with that said, the Center is our subcontractor, but the department has oversight of the entire Elevate Youth California program. And so you may hear of us in the event there are other funding opportunities outside of Elevate Youth California. I know that this is a capacity building track, but the really exciting thing about this being a DHCS grantee program is that there are so many grants right now that our department is really making available to the entire community of California. And so you may hear from us in the future, but with that said, you'll mostly hear from the center and Palvinder being the lead on that. So congratulations, and we welcome you to the Elevate Youth California program.
Thank you, Jessica. The next slide. We're going to cover just a broad overview of the Elevate Youth California program. You'll probably see some pieces on here that aren't applicable to your track, but we still like to go ahead and share a very broad overview. Probably saw this in the RFA as well, so hopefully it's not new. We do ground Elevate Youth California in social justice youth development, really wanting to center young people, youth and young adults ages 12 to 26 and the work that's being done. And our hope is that the work isn't just, our programming for young people or youth or young adults. It's really in collaboration with them and ensuring that they're centered and are even leading the programs. We do support a statewide network. As Jessica mentioned, we've currently to date made 290 awards. We currently have 264 funded partners with the Elevate Youth California program right now. So you're our newest cohort, which is really exciting. And again, we really want to ensure that we're focusing on youth substance disorder prevention, education, and early intervention startup activities. So really thinking about what does it look like to prevent and educate around substance use disorder in communities that have been disproportionately impacted by the war on drugs. And overarchingly, we do support both in low-income urban and rural areas throughout California. We have funded partners who are doing work across 53 counties and actually touching all 58. And overarchingly, the program does focus on impacting policy, systems, and environmental change. For your cohort, this isn't as applicable as of right now, but our hope is that we would allow you all to, if you haven't been engaging in policy systems or environmental change, our hope is that over the next 2.5 years, we start to get you all thinking about the policy advocacy work that's happening. What changes do young people want to see in their local or greater communities, and being able to try to even have you competitive for a standard truck award. Next slide, please. Our guiding values for Elevate Youth California are listed here. We really, again, invest in youth empowerment, leadership, and development. Again, it's not just activities or programming for young people, but really allowing them to lead as well. So we've seen this done in multiple ways, of whether it's internship programs or youth leads that are supporting on the program and helping design it and shape it. And so it's really up to you all on how you want to center young people. And we'll share later, we do require one minimum youth listening session a year. That really allows us to make sure that young people are being heard. But again, we have funded partners who do that in various ways. And we also want to ensure that we're implementing programs through the cultural lens of the impacted community. There isn't a one-size-fits-all model here. Really looking at our funded partners as the experts in the field, coming from the communities that they're working with, and really supporting youth as well. And so we look at you as those experts and ensuring that your program is implemented through a cultural lens. So, being able to understand those cultural nuances that exist in each of our communities and being able to support folks. And this is at all levels of the social ecosystem. So, looking at individuals and the direct work happening with youth and young adults, but also beyond that, what are those sort of interpersonal impacts that they've had? Do they have family members that engage in problematic substance use? How is that sort of impacting adverse childhood experiences? And then also at the community level, what sort of impacts are being made in terms of availability to substances or access to substances or lack of access to health and social services? So really thinking about at all levels of the ecosystem, how is this impacting youth and young adults? And so we encourage you as you continue to plan and implement, or in the planning stages and then are in the implementing stages of your program, to really come back to this and really center this back into young people leading and being empowered to do this work, but also the various impacts that play a role in where young people are at. Next slide, please. So now getting into your specific track. So you all are known as the capacity building cohort or capacity building track. We currently have 3 tracks, but we'll focus on the capacity building one. Our goal is to really ensure that we're able to strengthen the organizational capacity of emerging grassroots community-based organizations and tribal organizations. In addition to the programmatic approaches, the work with young people, the work for young people, and where young people are leading, there's also a key component to ensure that you're building your organizational capacity as well. So again, the age range for young people in this program are 12 to 26. You can go beyond that because there is a family engagement piece, but you'll notice that when we talk about our data collection tool and our data reporting tool, that we really focus on the age range of 12 to 26. And we want to make sure that this age range is prioritized through the funding. Of course, if there are people who are younger or older, you can engage with them, but our hope and our priority is this age range. And again, we mentioned those communities that have been disproportionately impacted by the war on drugs. We really take a look at race and ethnicity in our selection process and ensuring that we're really, addressing the harm that has been done by the war on drugs. Next slide. And so you've seen the phrase social justice youth development and wanted to share a little bit about what it looks like in action. And so, Elevate Youth California is a youth social justice mentoring and peer support program. So when you applied, you had an option to either select, mentorship and or peer led supports or peer-led peer engagement. Some may have selected both, but really ensuring that young people are mentored or are supporting in the mentoring process, as well as they're receiving peer support as well. And some of this might look like youth-led organizing, student activism, campaigns to address a school or community concern. We've seen a number of organizations, work around either Narcan trainings for schools, or have seen there to be a disproportionate rate of suspensions and expulsions for youth of color, students of color. So they've looked to address that. Others want to address change as a social condition through public policy. Some of this has looked like local funding to greater youth programming. Others has been about safe spaces or reimagining safe spaces. And so we have some partners in Southern California who have, amplified green spaces in their local community and parks and rec areas that may not have been historically youth safe or friendly. And so they're investing in those areas as well and ensuring that the policy at the local level supports those areas too. Again, your cohort is not required to work on a specific policy or advocacy goal, but we do ask that you begin to think about this and really over the next 2.5 years, seeing how policy or advocacy might be of interest to the young people that you're working with. Next slide. And substance use disorder prevention. When we talk about prevention, it encompasses all of the activities that promote healthy behaviors, reduce risks, and build protective factors. When we talk about prevention, we're not just saying, educate young people on substance use disorder, substance abuse. We found, there's traditional prevention practices that have found that to be helpful in some areas, but not in others. But we're really thinking about how do we promote healthy behaviors. Some of the communities that you're working with have been under-resourced. Young people don't have the places or the space to engage or the resources to be able to support their learning and just support them to grow into youth leaders as well. And so really thinking about that, also thinking about reducing risks and building protective factors. So we encourage you as you think about, as you kind of move on to your next phase of planning and implementation, to really think about this of what, when we talk about prevention in the broadest way possible, how can young people be supported through promoting healthy behaviors? What are the risks that they encounter? How do you help support reducing those risks? And how do we continue to build protective factors? Because we know that the experiences of young people in rural areas are not the same as those in urban areas. We know those who are on tribal land, it's not the same thing for those who are in other areas, and same thing for race, ethnicity. So there are variances and differences across youth and communities in the state. And so we want to be sure that we're looking at this, particularly with the young people and the communities that we're working with. We also want to ensure that we're promoting harm reduction. And so really looking to reduce at-risk, moderate, and high-risk behaviors often associated with substance misuse. So, the last thing we want to do is turn away a young person who might be engaging in substances, but really looking to support them and see how do we reduce the harm that might be associated with substance misuse. So again, and we've talked about this with some of our previous funded partners where they might have received other funds and they may not be able to engage, or they have a zero tolerance policy. But again, really thinking about what does harm reduction look like with the youth and young adults you're working with. Next slide. And some implementation strategies, I mentioned this before, but youth activism is a key component of the program, but you'll also have the opportunity to either engage in mentorship, relationship building, or peer-led support and leadership programs. So we invite you all to think about this as you develop your TA and work plan, which Shira will be covering later in the conversation. And then we'll have some greater resources around that. But, we really want you all to ensure that you're taking the next few months to really think about what does your program look like and build it out in a way that is in great alignment with the Elevate Youth California program overall. Next slide. And, you might be wondering, how do I find out more information about who's funded? I want to connect with other folks. We will have networking opportunities that we have almost monthly, but, at a glance, you can see our partners on our website. So you can find more information about the program, the funded partners at elevateyouthca.org. We currently have 3 tracks: the standard track, capacity building track, and our innovation track. And so you can find out more about all the funded partners across. And if you wanted to specifically find out about your cohort, it would be under cohort 3, capacity building. Next slide. And here's where you can find it. It's a screenshot from our website. You go under the program impact, and then it'll be a drop down, and you'll select cohort capacity building cohort 3, and all of the partners are listed here. Next slide. Again, to date, we've made, or we currently have 264 awards to community partners. Those are active awards. And then we have 53 California counties. I think the numbers are a little bit off on this slide, but we're currently at $210 million of investment. This is the slate of all funded partners from all of the rounds. We also will have an updated map that shows the current active partners, and go to the next slide. I think it might cover it. Or sorry, just questions, but our current map online has all of our funded partners. So we'll pause here for any initial questions that might have come up. I know my colleagues have been really great at responding to the comments in the chat. Just to reiterate, the slide deck along with the recording of this webinar will be shared with all funded partners. If you have any questions or if you're not added to our listserv, we encourage you to make sure that your organization and your award notification received a contact survey. And my colleagues are also following up with any organizations who didn't respond to that, but we encourage you, your team, to add you to that list. And if not, you can drop in your chat and we'll name and organization and email in the chat, and we'll be sure to add you to the list as well. Okay, we will share next steps for grantees. This is, of course, really I'm guessing for a lot of partners, this is really why you're here. So we're just going to cover that next. So we'll go to the next slide. So we'll talk now about the contract agreement process and insurance requirements. And there's a question in the chat about which counties do we have coverage in. So we have coverage in 53, full coverage in 53 counties. And what I mean by full coverage is that an organization is spending more than 10% of their Elevate Youth, or they're working with more than 10% of their youth population in that county. We have about 5 counties that there is UIC programming done, but it's not at a higher percentage. And so that's 53 counties, and our map online shows those counties as well. Thanks for that question. Okay, next slide. So the contract agreement process. So I was hoping that today you would receive an email from by today you'd receive an email, but you haven't yet. So don't worry about that. So this week you'll be receiving an email from Conga Sign with a link to your organization's subrecipient agreement. This agreement has all of the details of your Elevate Youth California award, which includes your budget, the requirements, and all of the details associated with it, along with additional pieces around what's allowable for the award, needing to go ahead and have approval for out-of-state travel, making sure that you're following the CalHR per diems, all of that for travel. So it has a lot of information. It is a lengthy document. It also links to our Prime agreement with the Department of Healthcare Services. And we really do encourage your team to review that contract agreement in detail. Our team will support with some additional information around some of the travel pieces I mentioned to make sure they're just reminders for partners, things of that sort. But it is really important that your organization reviews the contract agreement. I know it's long, but again, it has critical information for this program, and you want to ensure that you're going to be compliant over the course of the award. So we really encourage you again to take the time to review it, to dive deeper. If you have any questions, you're more than welcome to email us. And then you'll go ahead and sign the contract agreement via Conga Sign. The individual that will receive your it'll be the executive director or CEO of the organization. If you're a fiscally sponsored program, the fiscal sponsor will receive that agreement. So it'll go directly to that individual who is signing, and the email will be from the Center at Sierra Health Foundation via trust layer with insurance requirements, and that'll also include insurance requirements. So your agreement has insurance requirements. We'll also look to send those out separately. But again, if you have any questions around that, it is. So over the next few slides, Yadani is going to cover insurance requirements. And I don't want folks to get overwhelmed or feel like they have to take a quick screen grab. You are welcome to, but all of those insurance requirements will be listed in your agreement as well. I think with that, I'll pass it over to Yadani.
Hi, everyone. So I'm going to do a little overview of the insurance requirements. Again, like Palvinder mentioned, don't get too overwhelmed. You will be receiving, I actually sent out the notifications from Trust Layer May 16th. So if you have not received those notifications yet, reach out to me using that insurance compliance email, and I will resend you the link or update your contact information. That link will have all the coverage requirements and limits that are needed for this program. That is something that you can share with your broker, and he will help you out with that. I do encourage everyone to send me over their certificates of insurance as soon as possible. That way it gives me time to review and let you know if there's any coverage missing. We do expect insurance requirements within 30 days of executing your agreement. So if you receive your agreement sometime this week, 30 days from there, that's when that's the window that you have to get me your insurance requirements over. So we do also have a resource, Cal Nonprofits Insurance Services. If you are having challenges obtaining any coverage, I do suggest you reaching out to them. Next slide, please. Here is an overview of your commercial general liability that we require. It is very important that the bolded paragraph is included in your certificate of insurance. Again, all this information will be on that link that you received from Trust Layer. But most importantly, additionally insured endorsed has to be on that certificate or it will be denied. Next slide, please. We are also requiring auto liability. The coverage must be applied to owned, hired, and non-owned autos. If for any reason your organization does not own any autos, please reach out to me and I will see what I can do. Again, additionally, insured endorsement for auto liability is required as well. Workers' comp and employer's liability. It's very important that your broker includes a waiver of subrogation endorsement. And we also require professional liability. Next slide, please. Additional requirements, certificate holder must read exactly how it's read on here, Sierra Health Foundation, and our address. Description of operations must read that paragraph. And it must have the agreement number also on there. So those are very important points of your certificate of insurance. Next slide, please. Here is an example of a certificate of liability insurance. Most of the time, all those coverages will be included on here. And if you guys have any questions, please do reach out to me using that insurance compliance email, and I'll be happy to help you. Next slide. I believe that's it. Thank you.
Yeah. Thanks so much, Yadani. I know there's a few questions. If you have any questions related for your insurance compliance, that there's an email which will drop in the chat that you can send over. At this time, Yadani has mentioned that every organization has received an email from Trust Layer. It is probably your primary contact. If you did not receive that, you can go ahead and email us and we'll go ahead and make sure, or drop in the chat, again, include your name and then say, you know, this is the email that should be receiving the insurance our insurance email from Trust Layer. So, but again, I'd encourage you all to go ahead and check with your organization first. It's very likely with the primary contact from your organization. And all of the details are included on the email and the link to Trust Layer that was sent out last week. There's some questions. If we do not correctly have an area of coverage such as auto, is this a cost we can bill for? I can answer that question. So yes, if there's insurance on here that's, and since this is directly applicable to the program, you can include it in your indirect expense. If your indirect expense is not over 20% already. If it is, we can go ahead and have a conversation around that to having it as potentially a direct expense. So you're more than welcome again to include insurance as a indirect expense. If there's an organization, Bianca, if you can go ahead and include your name or your organization name, so that way we can go ahead and follow up with you on the submission that you've had. Thanks for folks who are updating their contact information. We can make sure to make those updates on our end. There was another question, cyber insurance was mentioned in the grant requirements. Cyber insurance was mentioned in the RFA, that is correct. However, we did revisit the insurance, our organization's insurance requirements recently, and that was removed given the particularity of this program. So only the insurance that's included on these slides, as well as it should be the same in trust layer and the same that will be coming in the subcontract agreement. Those are the only insurance requirements that are needed at this time. The other piece I'll say is upon execution of your contract or subcontract, meaning that your organization signed, our organization has signed, and the securing of your insurance requirements is when we can issue your first payment. So we cannot issue your first payment until that is done. So we really do encourage you to go ahead and start working on the insurance requirements. For organizations that work with a separate entity for insurance, we are not able to work directly with that organization. You will need to work with your insurance broker or any external agency that is doing the compliance. You're more than welcome to have them select, for us to go ahead and send the trust layer emails to them. But again, your organization is required to go ahead and complete that. And again, for anyone dropping an info into the chat, make sure you include your organization name unless it's listed in your email address, which we can definitely understand and see. There's another mention of insurance for organizations dealing with youth is overwhelming and all bonkers. Don't deal with these lines of coverage. It would be helpful to refer sources for coverage that are familiar with your program. I'm not sure if I don't think there's a question here. But what I will say also is that we have seen there to be some additional challenges when an organization does do work on tribal land. So if we have any Native or tribal organizations that are that may have some challenges, we do encourage you to get in touch with us. We'd be happy to share contact information of other funded partners who have gone with this as well. We want to be able to support as much as we can, and we don't want you to have to fill out 10 different insurance applications to only be denied because the insurance broker might not work on tribal land. So again, if that applies to you or if you're having any challenges after the first application, feel free to reach out.
And Palvinder, if I may add, if you are having challenges, again, obtaining insurance, Cal Nonprofits Insurance Services is a good place to reach out to. They have helped other Native partners as well.
Thanks so much, Yadani. And with that, I'm going to go ahead and pass it over to Shira.
Okay, thank you. So we are going to dive into some of the grant requirements, and we'll also cover some of the programmatic components as well. So this next section will cover the subrecipient agreements, timeline, payments, reports that will be due to the center, and budget modifications. So thank you. So we'll start with the deliverable-based payment schedule. The Elevate Youth California program has a deliverable-based payment schedule. So this means that subrecipients are paid based on meeting contract deliverables. For example, progress reports and financial reports, and we'll look at those in just a moment. So payments will be made at the beginning of the project period, following the execution of the subcontract and completion of all compliance components, including insurance. And we just covered that. Also noting that the first payment will be made once the state has made its payment to the center, and this might take a few weeks after you complete your agreement. Future payments will be dependent on being current on all deliverables. Taking a moment to refer to the slide. So the second payment will be upon receipt and approval of progress reports 1 through 4, the end of year report, your year 1 financial report, and detailed expenditure listing. Your third payment will be upon receipt and approval of progress reports 5 through 8, your end of year report, your year 2 financial report, and detailed expenditure listing. And we will dive into those in just a moment. Please note that payment amounts are based on the budget submitted with your application, and payments will be made via ACH. And as noted earlier, we encourage you to refer to your subcontract agreement for more information on this and how to sign up. Next slide, please. Okay, so here is a snapshot of the items you will be submitting to the center. And we are going to dive deeper into each of these requirements as we progress through the slides. Next slide, please. So we will start with the technical assistance and work plan. So funded partners are required to submit a work plan. The work plan will detail what you hope to accomplish by the end of the project period. The work plan is cumulative and outcome-based. It is broken down into objectives, and under each of those objectives, there will be activities dedicated to achieving it. So a goal of the work plan is to identify your project objectives, the activities, the roles and responsibilities, and the timeline that will lead to strengthened programs, sustainability, and increased capacity. So you will be provided with a pre-recorded training, and there will be office hours to support you in fulfilling this requirement. In addition to the recorded training, we will provide you with template and supporting tools. The technical assistance plan will explore your organizational strengths as well as the challenges that you're currently facing. It provides space for you to share how the center can provide support in overcoming those challenges to achieve desired outcomes. This support might come in the form of training and workshops or coaching tailored to your cohort's identified needs. Similar to the work plan, there is a template for the technical assistance plan, and we will be providing you with that template, and there will also be supporting office hours. And more information on these two particular requirements will be provided in the next week or so. Quarterly progress reports. So Elevate Youth California funded partners are required to submit quarterly progress reports. Progress reports request quantitative and qualitative data. And similar to the work plan and the technical assistance plan, you will be provided with a recorded webinar training, a template, and tools that will introduce this reporting requirement and hopefully answer your questions. These materials will be shared in the next week or so. And as I mentioned, there will be an office hour opportunity to provide you with technical assistance. So the goal of the progress report is to capture the diversity of youth and young adults that are being impacted by your program. It also captures program activities and progress towards your capacity building goals. So we are specifically looking to see if looking at three primary outcomes, and that is the investment in youth empowerment, making sure that your program is being conducted through a cultural lens that reflects the population being served, and that capacity building is happening, that organizational capacity building. And we also want to learn about how the work is going. And so you'll see that in this particular report, there is a narrative component for you to share more deeply. Okay, next slide, please. So similar to the quarterly progress report, an end of year report will be required. As the due date approaches, the Elevate Youth California team will be providing training and support. So a goal of the end of the year report is to collect certain information that better fits on an annual basis rather than quarterly, particularly successes towards capacity building and work with youth and young adults. Other information includes maybe new organizational policies that have been adopted, what some of the outcomes have been for youth empowerment and mentorship, and also to collect data around your youth listening sessions that we'll touch on in just a moment. Next slide, please. So an annual financial report will need to be submitted after the first year of program implementation. It is connected to the approved budget. So that's the budget that was submitted. And it looks at how your approved budget aligns with your actual expenditures. It's here where you will include line item spending within the report template that's provided. And also we want to note that funded partners are encouraged and required to keep supporting documentation for all expenditures for the annual financial report requirement, and also the detailed expenditure listing. So on the next slide, you'll see a snapshot of what the annual financial report might look like. So you'll see that there are two columns in this particular report. One column is your budget, and so this reflects what was included in the applicant budget that you provided to the center, and then the other column is actuals, and so that is where you would put the actual amounts that you spent during that particular program year. There is a template for the annual financial report, and you will be provided with that template near the due date for the requirement. So definitely be on the lookout for that. Next slide, please. So in addition to your financial report, all partners are required to submit a detailed expenditure report or a general ledger. So the detailed expenditure report or general ledger should include the expense incurred, the vendor, the category, the subcategory if applicable, the exact amount allocated to the grant, the date, and an expense description. So this allows your organization to ensure that you are reporting actual expenditures, and it also makes sure that you have the records to detail this and to back this up. And so if for any reason the detailed expenditure listing is not aligning with your annual financial report or your approved budget modification, we'll ask that you make some adjustments to make sure that those documents align, and a resubmission might be required if necessary. This next requirement is a cumulative final report. The cumulative final report will be submitted at the end of the grant period, and it generally asks questions similar to those presented in progress reports. And so as the submission date approaches, the Elevate Youth California team will provide you with support via email and through office hours to make sure that you are able to fulfill this requirement. Next slide, please. Okay. So here are report submission dates. And so this might look familiar, as these dates were included in the RFA. So grantee partners are required to submit regular progress reports responding to the performance measures identified in their grant agreement and work plan, as well as financial reports describing actual expenditures of grant funding, end of year reports, and cumulative reports, all of which we covered in the previous slides. So this table summarizes the due dates for each requirement, and we're asking that you note that these dates will also appear in your subcontract. And the Elevate Youth California team does its best to provide you with ample reminders via email and through our monthly newsletter. We'd also like you to note that the center will provide reporting templates, training, and support for these listed requirements. Also note that the due date for the work plan and the technical assistance plan will be provided in the next week or so. Also, we'd like to mention that dates are subject to change. And if you ever have questions, please reach out to our team. We are here to support you, so please do not hesitate to contact us. So the report submission process. So when reminder emails are sent for the requirement, we will provide you with the steps on how to submit. Generally, reports are submitted to our team via email. If it's a narrative, usually it's in a Word document or PDF form, and sometimes we collect narratives through surveys. Your financial report will be submitted through Excel using a provided template, and our quarterly progress reports currently utilize Excel as well. As mentioned, for reports with templates, please use the provided template. So please don't go out and create your own. Please use the ones that we provide to you. And should you ever run into technical difficulties, please reach out to us. As I shared before, we're here to support you and to make sure that you have the tools that you need to be successful throughout this period. Next slide, please. Okay, so we are going to dive into the budget modification process. So we recognize that costs may have changed since applications were first submitted. And so as a funded partner, you may submit a budget modification. So partners may submit budget modification requests to more deeply align with their actual costs and expenditures. Currently, funded partners are only able to shift funds to allowable items under the funding opportunity. Moving dollars within already approved line items is easiest. However, if the following criteria are met, then a budget modification needs to be requested. So here is the criteria. So if any budget expenditure line item is expected to vary from the approved budget by more than 10% of the section total, please request a budget modification template. You'll complete that template and then you'll submit it back to us for review. Also, our team is pretty flexible when it comes to moving funds around, but we do ask that you submit a budget modification beforehand. For a budget modification, you will be asked to complete the template in Excel, send it back to our team through an email. And also we ask that you include an updated budget narrative reflective of the new requested budget. So once it is reviewed and approved, then you will use that particular budget for all future reporting. We encourage you to send your request in writing and to include your grant number in the subject line. We tend to send reminders about budget modifications before financial reports are due, but you may submit a budget modification at any time, and we kindly ask that you are mindful of the number of requests. So at this time, we'll take a quick pause to see if there are any questions before we continue on.
Thanks so much for covering that, Shira. We had a few questions, which I can go ahead and answer. Really appreciate the questions. So is it possible to expend program funds? Oh, it says prior to the end of the program end date. I might have misunderstood that. We do ask that you go through the entire award period. So our hope is that you are trying to expend funds during the duration of the award period. So over the next 2.5 years, that's what the application was for. But in the case that funds are expended, a month before, 2 months before, that might be, that's understandable that that's possible. But again, we do encourage you to have activities go through the end of the program date. And so what I will say, I had interpreted this as can you go beyond the program? So I apologize. That's usually what we get. The number one question we get is, we started late. Is it possible to go ahead and have a later end date? I will share that all funds must be spent down by the end of the award period. If at any point you don't think you're going to be able to spend down funds, we do ask that you reach out to us so we can create a plan for this. We don't expect no cost extensions or extensions. Our hope is that as this contract is renewed with the Department of Healthcare Services, Elevate Youth California funds seem to be continuous at this point. As Jessica mentioned, it is included in the legislation. So our hope is that funded partners would then be able to apply for that next round of funding. Of course, not guaranteed that you'll receive it, but again, that is the hope. Another question, in addition to the detailed financial report, do you require cancel checks and or invoices for expenses? This is a great question. We're going to have some additional trainings around the financial report, detailed expenditure listing, and desk audit that we'll be providing at a later date. It is important that you keep documentation for all expenses. If your organization is selected for a desk audit, you may need to provide the expense invoice information and that documentation. However, it is only for those who are selected for the desk audit, but it is a random selection for the desk audit, so you don't know if you're going to be selected. But again, it's good practice, even from a finance perspective, to make sure that you have record and documentation of all expenses that your organization is making. Again, we'll have an additional training at a later date. Another question that's not necessarily related to this question, but is around some first aid CPR training. We don't provide support with this, but of course your organization is welcome to go ahead and receive the proper training on this. It seems, to me that definitely looks like it's included in organizational capacity building if your organization doesn't receive that training, especially as you're working with young people. So that is something that you can do. There's another question about if the call is recorded. Yes, this call is recorded. The link will be shared with folks, as well as a copy of the slide decks. There's another two questions around funds distributed and invoicing. So you won't have to invoice. Again, this is a deliverable-based payment program, or this program is deliverable-based. So essentially at the execution, as Shira mentioned earlier, of the subcontract, as well as the insurance compliance insurance being secured, you'll receive your first payment. Subsequent payments will be made at the end of each program year, but more likely at the beginning of the next year. So basically next May, we'll send you a message saying your year-end deliverables are due. Those are going to be due in June. Once those are submitted, they're reviewed by the team and approved. We'll go ahead and be able to process your next payment. It won't be right at the, and again, these payments are provided not necessarily in advance. It's not an advance payment, so you're not invoicing against this payment, but it's made prior to the work that you're doing. So we try to do this to support organizations so they're not having to expend their own organizational funds. It's quite burdensome on organizations when they're having to invoice after expenses are made. But again, that's why it's extremely critical that you have the documentation for your financial report and backup. And so annually, so you'll receive 3 total payments. They'll be about a year apart, depending on when those deliverables are submitted. Again, we'll share some more information about all of this on a later call, but you do not need to invoice at this time for the program. There's a question around, can payroll fall under programs as well as payroll if it's part of program if part of program covers staff training towards capacity building? I'm a little unsure about this question. Can payroll fall under programs as well as payroll? I'm not sure what this is, exactly how this is going, but if you're going ahead and there's a particular section which you've already included in your budget is around personnel. So we don't necessarily have payroll, but we have personnel. So personnel is listed in one section. So any staff who are on the program are listed in that section. So we don't divide up between programs and training, but if there's additional context to this question, feel free to reach out and we'd be more than happy to answer it. Given timing, we're going to go ahead and move on for the next set of slides. Shira, I believe I'm passing it back to you, or?
Yeah, just
Okay.
for the next 2. Okay, thank you. So this slide quickly notes that there will be in-person and virtual convenings, and when they arise, participation is required. So we'll do our best to keep you updated on when and where convenings are taking place, and we will also be providing you with budgetary guidance. We can go to the next slide. So these are youth listening sessions. So this might be familiar to you as it also appeared in the RFA. So all funded partners are required to host a minimum of 1 youth listening session with youth engaging in your program each year. So the expectation is that young people are engaged throughout the project, and to ensure consistency on messaging and that project is resonating with its youth constituents, annual listening sessions need to be held. So youth listening sessions are defined as a designated time for youth to provide feedback on program strategy and how implementation is going. This is a unique activity from regular programming and is centered around youth voices. For some, youth listening sessions may be called or considered a focus group. So each funded partner is required to conduct one youth listening session annually, as mentioned, with a total of 3 youth listening sessions by the completion of the grant. It is suggested that you draft a series of questions that seek feedback and input from youth on a specific aspect of your program. This can include planning, program activities, policies to change, prevention campaigns, program materials, or just youth engagement in general. So a listening session can cover multiple aspects if the time and the planning permits. Listening sessions, in a nutshell, is a time for you to hear from youth. So please be sure that youth listening sessions are included in your proposed activities and budget. And also listening session data, including the date, participant count, and highlights, will be requested in the end of year report and may be included in the narrative section of your quarterly progress report. So at this time, I think there is another pause for questions before we switch gears.
And we'll actually just continue on because I don't see any questions, and we know we're almost at time. So we might run a few minutes over. So I apologize for folks, but again, this call will be recorded and we'll share the recording along with the slides with you all. So we are providing our communications overview on behalf of our comms team, which is in a training today, so they won't be able to join. With our comms team as well as our program team really looks forward to working with you all to share the stories about the amazing work that you'll be doing. We're really here as partners in this work. It's not just for us about I know we talked about the administrative piece because that's the #1 question that folks are having. Well, I will say it might be the second question or might be the top 2 question, because a lot of folks are also asking if the recording's going to be available. And yes, it will be available. We will provide the slide deck as well to folks after the call. So, we really are here as partners. So I want to make sure, and just to do a pause, for some of you, this might be a lot of information. For others who've received other grant funding, other programmatic funding, this might not seem like too cumbersome. It's something that you're familiar with. But what I want to say is that we're here as partners. Any questions that you have, we're happy to answer. We're willing to meet with you all. So again, we do encourage you all to be to reach out if you have any questions. We'll stay on over this call if there are any individual questions that folks have. All of that. Again, we're really here as partners in this work. And so, part of the work that you're doing through this funding, you'll have opportunity to share messages about youth substance use disorder prevention and just really serve as a spokesperson for your work. As you work with youth, as you host activities and build capacity, we really encourage you to capture stories, photos, and videos and share them with us, our community, and the local media. We have shared language about the program, which we're going to go ahead and share with you all, I believe, later this week as well. You'll receive our comms branding guidelines, which I'll share on the next slide. But again, as you choose to make public announcements about your grant and your work, as you share your stories with your community and possibly with local media, feel free to reach out if you have any questions. We're more than happy to support on that as well. We've had a number of partners who have said, hey, we drafted this press release. Is it possible for your team to look it over? Our comms team is more than supportive in doing that. So we want to make sure that you know that we're definitely here as a partner in this. Next slide, please. And as I mentioned, we've worked with the Department of Healthcare Services to develop the Elevate Youth California Communications Guidelines and Toolkit, which we'll send to you all soon. Apologize for the delay. We're just putting the final touches on it. This is going to include the logo use, color palette, fonts, graphic elements, social media tips, messaging, all of that. It'll have those pieces on there. And so what we really ask is that, again, if you have any questions, feel free to reach out to us. You do not have to, we do ask that you use the logo, the Elevate Youth California logo on your materials that are related to this program. However, you do not have to use the brand identity guidelines on revamping everything. If you do choose to, and you see that, it's better to be in greater alignment with the color scheme, things of that sort, feel free to, but again, it's not a requirement, but we do kindly ask that you use the Elevate Youth California logo on all materials that you're creating. Next slide, please. There's also going to be some funding statements, and again, no need to screen grab this. It'll be included in the branding toolkit, but there are funding statements. So when you are releasing, a press release, if you're going to go ahead and make a video, we ask that you include, either one of the funding statements on there. Again, this will be included in the EYC branding communications guideline brand and toolkit. So feel free again to revisit that when you receive it later this week. And so wherever space is limited, you can use the abbreviated funding statement, but we do ask that you do include the funding statement on any of your sort of formal communications, any of the materials that you're creating. If you create a video or anything of that sort, if you're using Elevate Youth California funds, we do kindly ask that you use the funding statement. Next slide. And if you have any questions about comms, feel free to go ahead and email the communications team. We'll go ahead and drop these in the chat. You'll also have it in an email that comes out shortly. And we always ask that you copy the Elevate Youth CA at shfcenter.org email on all communications to the center regarding your EYC award. If you're ever in doubt, just send an email to the Elevate Youth CA email and our team will go ahead and direct you where needed. Next slide. Okay, so we are going to have, we have a number of resources already available, but there's going to be additional ones similar. We'll go ahead and add this webinar recording to our website as well. You're able to go ahead and visit our website already to see the resources and trainings. We'll go ahead and include a link or some additional information about the trainings that we've had at a later date. We don't want to overwhelm you right now. We really want you to focus on what sort of are the emerging pieces right now. And I would say securing your insurance, getting that subcontract signed as soon as it is, and then beginning the planning of your program is really important. And then we'll go ahead and send additional information around the TA work plan, the quarterly progress report training that we'll have. We will have trainings or share resources before we have office hours. So we are again here to support and work in collaboration with you all. Next slide. Partner learning and engagement. I mentioned that we do have monthly networking sessions, so we'll go ahead and invite you all to the ones that I believe that are next month. We also have webinars by technical assistance providers, webinars by our team, and also various partners. We also do one-on-one sessions. So again, you're more than welcome to send us an email with any questions you have. And if there's greater sort of, you need to have a conversation, we're more than happy to meet over Zoom as well. Next slide. Seeing a handful of questions as folks are probably like, oh, that's like close to the end of it. So just some important reminders, again, around the initial payment. We can process that initial payment once your insurance has been secured, as well as the subcontract has been executed. Communications, if you have any questions around that, feel free to let us know. We'll go ahead and send the communications toolkit later this week again. And just a few different pieces to stay on top of. We'll go ahead and send a message about the quarterly progress report, as well as any virtual in-person convenings and resources that we have over the next few weeks. Next slide. And we're going to go ahead and stay on this slide. And I think this is the last slide anyways. So we'll go ahead and stay on this slide. It's just a contacts and resources. So of course, you can always send an email to me, copy the EYC email that's listed here, our website, as well as the center's website, which I believe the team will go ahead and drop in the chat. And I'll go ahead and answer questions, but before I do, for folks who do have to hop off, we really thank you all for being here. And again, take a moment, if you haven't already, make sure that you're celebrating your organization, the young people that you're working with, on receiving the Elevate Youth California Award. We're really excited to be working with you all over the next 2.5 months. And we're here to answer any questions that you have. So I'll take the questions that are in the Q&A piece as I see those up front first. Will press release form be drafted from the organization to give to families of youth participants? You're welcome to go ahead and draft a press release, or I haven't seen as often that a press release is given to families or youth. It's really, press releases are for the media to go ahead and share about that, but you're more than welcome to do that. I'm not sure, and I know when I'm thinking about families of youth participants, I might be thinking about like a media consent form. So we do have a template for that, which we can have our team share out too. I don't think that's what you're asking for, but I'm going to go ahead and mention that because many folks might already have their own, but we want to make sure that organizations are including the center as well, since we will be sharing those images that you share with us, or videos, we may be sharing them as well. And we want to make sure we have the consent of young people or their parents if they're minors. Elizabeth asked about, I'm just trying to check to make sure the same Elizabeth I've contact for. So Elizabeth, if you are with Concrete Development Incorporated, we noted your email, and Yadani will go ahead and update trust layer. But again, insurance compliance at Sierra Health, feel free to email them, and we'll go ahead and answer any of those pieces. But insurance will be included on trust layer, the email that comes over, as well as in your subcontract agreement. And again, we're anticipating that subcontract agreements will be going out to the CEO, executive director this week. Should we use the center's logo and the state's logo in addition to the Elevate Youth California logo? That's a great question. I would say no. I would say the Elevate Youth California one is the primary one. In your press release or any of that, if you really want to go ahead and acknowledge the other two entities, you're more than welcome to. But again, we really want to make sure the Elevate Youth California logo is the one that's primarily used. Is official start date the date of execution of MOU? No, this official start date is May 16th. So this was included in your award notification, that the start date, and it was included in the RFA as well, that the start date will be May 16th. It is the official start date of the program. So this program does run from May 16th, 2023 to November 15th, 2025. Okay, I think that is all of the questions that I see so far. Again, we'll go ahead and stay on if there's any additional questions. But again, thank you all for listening in. Thank you all for joining. And if you have any questions, you know how to reach us. Hope you all have a wonderful rest of your day, and congrats again.